The World Health Organization has recommended the first twice-yearly injection as a tool to prevent HIV infection. Now, the injectable PrEP drug is a long-acting alternative to the current daily pills, and this could make prevention more accessible globally at a critical time where such efforts have been stagnating. So let's discuss this. Dr. Bridget Hare, Senior Research Fellow at the Kirby Institute, joins us now. Dr. Hare, thank you for your time. Why is a twice-yearly injection so exciting when daily pills are already available?
It's because we're humans, and as human beings, we make mistakes. Taking a daily pill every day is arduous. People forget. Something that can be done just twice a year, it means it can actually dovetail in really nicely with people who take injectable contraception, for example, where you get that 3-monthly. It just makes it easier for people to adhere to the treatment regimen, and that is game-changing. I mean, this is the most exciting advance in HIV therapy that we've seen since 1996, I would say.
Yeah, so a big difference between taking a pill daily and having 2 injections a year. How does the drug work in this case, and how effective is it?
Yeah. Okay, well, firstly, it works by targeting a new part of HIV. So it's called the first in its class of a particular drug. It actually targets the little protein shell that's around HIV, and it stops that from integrating into the host cell's DNA. So that's really important, that it's actually looking at HIV in a different spot, which makes it a really useful treatment for people who have already run through other treatments and become resistant to them. But the really incredible news about this drug is, in a trial of people whom we know to be the people who have the hardest time taking pills, the drug was found to be 100% effective in preventing HIV. And that's in young cisgender women in Africa. So 100% efficacy in preventing HIV in that study. It's mind-blowingly good.
So you've spoken to one group of people there that would probably prefer this twice-yearly injection. Tell us more about who would prefer this as opposed to daily pills.
Anybody who has trouble with schedules, anybody whose life is complex, if you are a shift worker, if you have a whole lot of children, anything that makes it hard for you to stick to a regimen of taking a pill a day, this is going to be, a game changer for you. It's something that you only have to think about twice a year. Something that can just go in your diary. Anybody whose life is complex. Anybody who is living with mental illness. The list goes on and on and on. We'll probably find there are a whole lot of people who also don't necessarily have trouble taking pills, but people who find taking pills to prevent HIV stressful or triggering. For example, somebody who might have had partners who have, sadly, died from HIV disease, who don't want to have the reminder every day of taking the pill. I mean, the list of how many people or what kinds of populations might really benefit from this is enormous. But particularly, I think we should be focusing in on vulnerability, people who seriously have some difficulties in adhering to a daily schedule.
And tell us about the cost as compared to a daily pill.
Well, at the moment, of course, the cost is astronomical. We hope that the cost is going to come down. Of course, Australia has a fantastic single buyer system, which means that the price cost is negotiated nationally. The drug company is also making some efforts to make the drug available in low and middle income countries, particularly in low income countries. So we have moved on from the time when people just used to say, yeah, it's an expensive drug, that means only some people can have it. We've moved beyond that. We now see the question of justice in terms of access as being critical. So the drug company has certainly come a fair way toward trying to open up access, but it needs to be much bigger. Low and middle income countries are the places that have these burgeoning HIV epidemics, and they are the places that most urgently need access to this incredible game-changing drug.